Well, as you can see, the hall is empty for the moment. Thank goodness for that, because we've got the wonderful Chantal Mathieu, Vice President of EASD, to tell us about EASD 18 before it starts. So tell us, what's on the menu? What are we going to see that's exciting?
We want to keep up with the tradition of organizing the best annual meeting on diabetes worldwide, actually, where we typically blend not only basic research, translational research, but also bring the best of clinical research for clinicians to really learn what they should do in the treatment of people with diabetes. And this year we have the opportunity of listening to many highlights. There will be the presentation of, for instance, the outcome trial Harmony, looking at hard outcomes in people with type 2 diabetes treated with a GLP-1 receptor agonist. We will also have trials being presented on the use of adjunct therapies like SGLT2 inhibitors in people with type 1 diabetes. And a highlight to me is really on Friday morning, the presentation of a years-long work, namely the ADA EASD consensus on glucose-lowering therapies in type 2 diabetes, where we present really what we believe to be the evidence of the literature, the evidence of clinical trials, real-world evidence on how to treat people with type 2 diabetes.
And that will really be the new Bible, if you like, for the treatment of diabetes.
The ADA EASD consensus will really guide clinicians on how to choose the best glucose-lowering therapies in people with type 2 diabetes, taking into account the well-being of the patient, because we really put forward the fact that we want the patient to be central. The patient is central, and the aim should be to prevent complications in that person, being acute and chronic complications, but foremost, really to improve quality of life of the patient. And for that, we suggest, for instance, that lifestyle is crucial in the therapy of people with type 2 diabetes, that glucose-lowering therapy should be embedded in a multifactorial approach with statins, with blood pressure lowering and what have you. And also that on top of metformin, you now really need to take into account characteristics of patients. Like if you have cardiovascular disease, if you have heart failure, if you have chronic kidney disease, there are specific classes of agents, of glucose-lowering agents that should be preferred. If you don't have these characteristics present, then we also say that you should look at other issues, like for instance, should you really want to avoid hypoglycemia as a priority in your patient? Pick, for instance, DPP-4 inhibitors, SGLT2 inhibitors, thiazolidinediones, and GLP-1 receptor agonists. If, for instance, avoiding weight gain is an issue, pick another class of agents. So it's really focused on the profile of the patient.
Now, for any ordinary doctor out there, diabetes gets more and more confusing, more and more drugs, more and more ways of measuring glucose. What's going to happen to simplify things over the next 5 years or so?
Treatment of people with diabetes will not simplify. It will only become more and more complicated. It is a very complicated disease, and thus we need to do our best to really educate all of the healthcare professionals who are dealing with people with diabetes. For that, we have in EASD a whole postgraduate program of education. And so we are now developing e-learning modules in a whole integrated e-learning program to really help doctors, not only in Europe, but worldwide, to really learn about diabetes and adapt the therapy to what is now to be found, for instance, in the consensus on glucose lowering that is presented, but also in the guidelines locally.
Now, you're regarded as the EASD's resident futurologist. What's in your crystal ball for the next 10 years?
It are exciting times for diabetes because things are changing everywhere. in type 1 diabetes, in type 2 diabetes. If I look at type 1 diabetes, there of course we're still aiming to find a way to prevent this disease, to cure this disease. And when I look what we are now achieving in networks like the one I coordinate in Europe called Inodia, we are making progress in biomarkers and also really touching the possibility of preventing this disease. In cure, a lot of research going on in stem cells, a lot of it being presented here at EASD, with stem cells being the source of replacement of beta cells. Now, if you look at type 1, also a lot of advances are happening in artificial technology, so in artificial pancreas, the pumps, the sensors, the algorithms really moving to the forefront in type 1 diabetes. Also in type 2 diabetes, exciting times. First of all, the acknowledgement that type 2 diabetes is so much more than just a glucose disease. It's embedded in a whole metabolic picture where you have issues of weight, issues of blood pressure, etc. And so now having access to agents, and even more in the future, to agents that not only affect glucose, but also affect weight, blood pressure, and eventually hard outcomes in people with type 1 diabetes is really what makes it exciting in coming years.
Well, some absolutely terrific things coming up there, and you can see it all on easd.org.